So based on the assessment that you've had with Dr. Smith, I've come to realize that you have what is considered vaginismus.
What?
Vaginismus.
Is that contagious?
No. It's actually it's a common problem that a lot of women have, in which is basically your pubococcygeus muscle is tightened. And so the whole process of the treatment is to learn how to relax that muscle so that intercourse could be more comfortable and even pleasurable for you and for Tom. So, are you guys okay?
I guess, I mean, you probably have a lot more questions.
Do you have any questions or concern about the treatment process?
Yes, I have fear. It's extremely terrifying right now because I think it's gonna be so hurtful. So I'm not sure if I can go through that. So I don't know. I don't have confidence.
And that's a valid emotion to have, I mean, especially since the things that you've gone through. One thing I want to reassure you is the whole process of treatment for vaginismus is that you have complete control. You take control of penetration, when it happens, how it happens, and how much happens. And so that's something that you can kind of feel comfortable with, as in you are in control and no one else is. Okay? So I'm looking over some of your sexual genograms. I'm going to kind of ask you questions just so I can get a better understanding. Okay, so I guess I'm wondering how this has affected your marital relationship. I know it says here that there was like no sex taking place, and so I just kind of want to understand what's been going on with that.
Since he wants to have a baby, but I cannot have intercourse, and I just feel pressured by him. But I like him, and I want to have a baby, but I just have so much pressure on me.
And I want to thank you, Tom, for being a part of this process with Clara, because I really believe that you being here and kind of understanding what's going on would kind of help her out and feeling more comfortable, and eventually that this can be a process that will help the both of you, and it's not just an issue for her because it affects the both of you. So I want to thank you for being here for that. Okay, so I want to go straight into, I guess, some homework assignments that I will start to assign to the two of you. But the first homework assignment is going to be specifically for you, Clara, and that is utilizing your pinky finger. Okay? Okay, and so I want you on a day that you're really relaxed, you know, and you're home by yourself and it's private, the baby's at a babysitter, to find time when you can just lay down where you're most comfortable. And I want you to lubricate your pinky. And when you lubricate your pinky, I want you to insert it inside of your vagina. And so you know where that is. And
Like how long?
well, I mean, you will slowly insert it until you feel resistance or pain. When you feel resistance and pain, you can stop. Don't necessarily pull it out, but just kind of stop, leave it there, kind of breathe in, breathe out, and remember that you are in control. And then once you feel like you've probably kind of relaxed your muscles a little bit, kind of insert it a little deeper to see how that is. Now, if you try it the first time and there's no pain at all, I would like to encourage you to then try your pointer finger and your middle finger. If there's no issue with that, then try using 2 fingers.
2 fingers?
2 fingers. Okay. And don't feel pressured at all when doing this, because like I said, you're just trying to relax your muscles. That's all this treatment is about, relaxing your muscles and being in control of the amount of penetration that you have. And so if you feel that, oh, the pinky's fine and this is fine and this is fine, then you try the two fingers. And then once you're able to get to that point of inserting 2 fingers without any pushback or any pain, then what we can do is then incorporate Tom into the treatment process, and then kind of getting you used to being intimate with yourself in front of Tom. And so he can kind of see
In front of him?
in front of him, your husband. But you know what? So let's not focus on that right now. We're going to more so just focus on you. I just want to give you just a brief snapshot of what will come, but to focus on doing that. So does that seem like that's an exercise that you'll be willing to do?
Yeah, sounds okay.
Sounds okay. All right. And Tom,
Yeah, I mean,
does that sound like a good treatment plan?
sure. I mean, anything that you think will help, I'm hopeful, that it'll
I try.
Well, I guess I will see you two next week and to kind of find out how that process went for you, how you felt about it, if there was any pain, and kind of do a scaling like Dr. Smith did with you during the assessment portion. Okay? Thank you.